Periodontal disease is a fact of life. 3 out of every 4 adults will have some form of it during their lives. That's the bad news. Now here's the good news. Periodontal disease can be treated and controlled. Your dentist can do it, or he or she may recommend a specialist. What's important to remember about periodontal disease is that your dentist can treat it, but you're the one who's going to have to take care of your teeth and gums. You and your dentist are going to be like partners, and the partnership involves saving your gums and your teeth. Periodontal disease is the primary cause of tooth loss in adults, but it can occur at any age, even in children as young as 5 or 6. There are a variety of factors that contribute to periodontal disease, but the most common are physical and chemical irritants in the mouth, such as food that becomes impacted between your teeth, heavy use of tobacco or the improper use of dental floss and toothpicks, badly aligned teeth, poorly fitting bridges or partial dentures, improper restorations or defective fillings, biting your nails or grinding your teeth. This grinding of your teeth is known as bruxism. Bruxism places extra pressure on the alveolar bone through the teeth and can lead to further bone and tissue damage. A lowering of gum tissue resistance through poor diet, pregnancy, certain blood diseases such as diabetes, and certain medications such as oral contraceptives, anti-cancer therapy drugs, steroids, and some types of anti-epilepsy drugs. If you are taking any medications regularly, you should inform your dentist. Although the above factors can contribute to periodontal disease, they don't cause it. The primary cause of periodontal disease is bacterial plaque and its byproducts. The removal of this plaque through conscientious daily flossing and brushing is an excellent way to help yourself improve your chances to prevent disease. Remember, periodontal disease is preventable. If you already have the disease in a severe form, daily home care combined with professional help can diminish the severity. However, periodontal disease may reoccur even with your best efforts. Let's take a look at the role plaque plays and what happens at each stage of periodontal disease. First, we see healthy gum tissue called gingiva, with teeth resting naturally in their individual spaces, surrounded by the periodontal ligament that connects them to the alveolar bone. Plaque and its byproducts form on your teeth and gums. If you don't floss and brush your teeth daily, plaque builds up, endangering your teeth and irritating your gums. At this point, your gums can become red, tender, swollen, and bleed easily. If these symptoms are present, you probably have gingivitis. At this point, the disease is considered not only treatable, but reversible. This is one of the primary reasons your dentist recommends regular checkups, because certain areas of your teeth and gums cannot be reached with a toothbrush or dental floss. As gingivitis persists, the gum tissue will remain inflamed and become enlarged or swollen. This persistence of gingivitis can lead into the more advanced form called periodontitis. If the periodontal disease process is allowed to continue, it may lead to further infection of the gum tissue and erosion of the alveolar bone as the resulting pockets get deeper. The infection spreads and the damage worsens. Once your condition goes beyond plaque buildup, simple brushing and flossing is not enough. You'll need professional care to monitor your gums and to conduct the removal of these byproducts only your dentist or hygienist can perform. If your dentist suspects that you have periodontal disease, he or she will suggest that you have a full set of intraoral x-rays taken and will conduct a probing of your gum tissue. The treatment you're going to receive depends on what stage your periodontal disease has reached at the time. If the disease is in its earliest stages, your dentist will simply remove the plaque and calculus and clean the area around and under your gums. This procedure is known as scaling. If the disease has progressed beyond this initial stage, your dentist will clean the plaque and the calculus out of the small pockets that form in the collar of the tissue that surrounds the neck of the tooth and leads to infection. Often, the tissue that lines the tooth pocket is removed. This procedure is known as curettage. Then your dentist will smooth the root surface. That's called root planing. Although treatment and containment are possible, periodontitis means that the bone holding the tooth in place is deteriorating, and once the bone is destroyed, it cannot be repaired. If bruxism is contributing to your condition, it can be treated. The treatment of bruxism consists of the selective recontouring of the teeth in question, or restoring problem teeth. In many cases, a bite splint or guard may be needed. If this is necessary, you will usually have to wear what is called a night guard while you sleep. Another thing you can do for yourself is to exercise good judgment in what you eat and when you eat it. Practice moderation by limiting snacks and eating a balanced diet. Fresh fruits, vegetables, breads and cereals, fish, milk, and other dairy products are all part of sensible, responsible eating. Regular dental checkups are also essential to not only helping prevent the worsening of periodontal disease, but in helping to prevent its recurrence if you have been treated for gingivitis. But remember, once the disease goes beyond gingivitis and into periodontitis, it is not reversible and the permanent damage will need professional care. Periodontitis means that the bone holding the tooth in place is deteriorating. Once the bone is destroyed, it cannot be repaired. Even when surgery is needed, periodontal disease can usually be contained. The most important question of all remains, are you willing to work to help your dentist save your teeth? After the disease is treated, continuous professional care will be needed to help control the disease and maintain the health of your tissues. This maintenance will consist of regular periodontic visits, perhaps every 3 or 4 months, with scaling and probing of the teeth, evaluation of the gums tissue, and your bite. Now, you know the facts of life as far as periodontal disease is concerned. It's something you can live with if you join your dentist as a partner in maintaining good dental health.